Hi, this is FPTA President Jamie Dyson, and I wanted to give a brief update of all of the activities that's been going on behind the scenes to improve the practice of physical therapy in the state of Florida. Before I get to the chapter activities, we did have a great victory nationally with the elimination of the 20-year-old therapy cap. That being said, there was an amendment that was added at the last minute, which decreases the reimbursement for interventions provided by a physical therapist assistant to 85% of that of an intervention provided by a physical therapist. The APTA does not agree with this amendment and will be doing everything it can to eliminate that last minute amendment. As a result, APTA has put out a challenge to the physical therapist assistants across the nation. Their challenge is to get the PTA membership to 10K. By doing this, we're showing that we are better together in bringing both our physical therapist and physical therapist assistant members together to fight this decrease in reimbursement. As a result of the elimination of the therapy cap, um, there was a drop in the threshold for audits. So that went from $3,700 to $3,000. And as a result, once the bill it gets above $3,000, the KX modifiers will still come into play. And based on that, there will be random audits done to all bills above $3,000. CMS will not be increasing the number of audits it will be doing, and it will be done randomly. So they'll be looking for trends. They'll be looking for folks that will possibly be abusing the elimination of the therapy cap. As long as your documentation is strong and the justification for physical therapy is there, you should have no problems. On a local note, within the chapter, first off, I'd like to congratulate our task force on dry needling, led by member Rob Stansborough. These guys have been working really hard, and as a result, the Board of Physical Therapy Practice has developed rules for the practice of dry needling within the state of Florida. So what does that mean? Well, from there it goes into possible legislation. So we are not able to practice dry needling yet, but we've started the process. We've come further than we ever have before, and hopefully in the near future we'll be able to practice this intervention within the state of Florida. Aside from the task force, we'd also like to thank our CEO Tad Fisher and our legal counsel for getting this moved forward. They used the rules that FPTA had developed and really did very little amending to those rules that we had sent in. So great job by the task force, our legal counsel, and of course our CEO Tad Fisher. On a legislative front, we had a great victory with the opioid bill. Basically what happened, FPTA recommended two amendments go into the bill, and they were accepted and voted in by the House. There still needs to be a vote on the Senate side, but we believe there's very little opposition to it, and it should move through the Senate and finally signed by the governor. What these amendments state is that physicians who will be prescribing opioid medications would need to go through mandatory education. And a part of that mandatory education will be the non-pharmacological methods for managing pain. And within that, of course, is physical therapy. So physicians will be educated on how physical therapy can reduce their patients' pain and be a non-pharmacological method of pain management for their patients other than just prescribing opioids. On a reimbursement note, some FPTA leaders, myself, Tad Fisher, and members Mark Bishop, Ruth Jenkins, and Jackie Osborne had a great meeting with Florida Blue this past week. As a result, Florida Blue is looking into beginning two pilots. The first pilot would be looking to reduce falls in older adults. Basically, what will be happening is they'll be taking small pockets of their members, of the Florida Blue members, and providing an annual assessment by a physical therapist to see if that patient is at risk for fall. This is going to be way more than a screening. It's not just going to be a 5-minute screening. It will be a full assessment by a physical therapist, and any recommendations by that physical therapist will be carried out. Again, this will just be a small pilot. It will be a direct access assessment, so the patient would not need a referral. They go right to the physical therapist to get their annual falls assessment. This is a great stride for our autonomy of practice. Basically, what we want to be doing with our Doctor of Physical Therapy degree. The second pilot will be again used to help to decrease the use of opioids for patients with musculoskeletal injuries. What will be happening is they'll be partnering some primary care physicians with outpatient clinics, outpatient physical therapy clinics throughout the state of Florida. And as patients come into their primary care physician with a musculoskeletal injury, they will be referred immediately to one of those outpatient physical therapy practices for immediate intervention without without having to go through insurance for approval. The goal of this is to A, help decrease the use of opioids, B, decrease the number of specialists the patient is referred to, and C, decrease the use of radiology for these patients. We all know not all these patients need to have x-rays, especially if it's a soft tissue type injury, and we can make a lot of strides in helping these patients without the use of opioids and the use of radiology and the use of specialists. So we're excited for both of these. More to come on when they will be starting. But hopefully they'll be starting in the very near future. Just wanted to give a few kudos out. First of all, we'd like to congratulate FPTA member Greg Hartley for being elected to president of the Academy of Geriatric Physical Therapy. Greg is out of Miami, and I think we all know Greg. He's going to do a great job in that position. We'd also like to congratulate Gina Mussolino, who will be stepping down as president of the education section. Gina served her 2 terms and has termed out, and we want to thank Gina for her service to the education section and her service to the practice of physical therapy, not only nationally but within the state of Florida as well. Greg joins 2 other FPTA members who are presidents of sections of APTA. The first is Jane Fedorsik, who is president of the section on head and upper extremity, and Diana Cornetti, who is the president of the home health section. So congratulations to all of those folks. We have some great talent here in the state of Florida, and we're really proud that you're part of our membership. Lastly, we'd like to congratulate all of the new certified clinical specialists who received their certification at CSM in, where was it? In New Orleans. Man, sorry, long week. Yep, who received their certification in New Orleans. And congratulations. We'll be listing all of those members in an upcoming issue of Weekly Update. Thought I was going to make it without any bloopers. Oh well. Thank you for tuning in, and I'll have more information for you as we move forward being better together in FPTA.